So, dear colleagues, I can see that people are joining us, but maybe I can offer us to start step by step, okay? So, greetings. Uh, Welcome at the meeting of MHPSS TWG at national level. So, today our meeting is like informative technical discussion. So, the mental health services for elderly people, that's what we're going to discuss. Okay, you know that we have two formats of meetings. One format, one of these is discussion. So today we have the second format, the discussion. So we will listen to presentations from various stakeholders, their reports. Also, we'll get it from various subjects engaged and those working with this target group. I speak of elderly people, yes. We've been discussing how properly should we name them in Ukrainian. So they're the priority group for humanitarian response as well, because unfortunately, quite often these people are left uncovered by services. They're left beyond the scope. And quite often there are some difficulties with access to this target group or engaging them, specifically elderly people, I mean, to the process of service delivery, to response, and also uh, in recovery efforts, we may have some challenges. We'll discuss it in details today. The problems, we'll discuss the existing approaches, global frames that we use in our work to cover elderly people as beneficiaries. And this meeting is going to be very interesting. First of all, just a couple of organizational aspects. I'd like to remind you that we have simultaneous interpretation and you can actually use different channels, English or Ukrainian. So we have English speaking participants. So please use the interpretation function if you need. You can pick the interpretation function in the bottom panel of Zoom. So we would love you to introduce in the chat right now. Please put your name and organization to add you all to our minutes as participants. Okay, colleagues already are doing that. Thank you so much. And apart from that, I'd like to tell you that please do not use the AI-based tools for meeting notes because we have our own minutes today and all the materials, we'll share that with you after the meeting. So please don't worry. You'll get all the presentations and the recording when it's over. Okay? And basically for us, not to waste more time, not to keep us to the line, let's start. So I'd like to start with a report of our colleagues from the Coordination Center of the Cabinet of Ministers. Miss Anna, you're so welcome. You can share now. How is the Coordination Center helping to deliver services to elderly people and at region level as well? So, Miss Anna, thank you so much for joining us, and please, you're welcome. So, greetings, colleagues, partners, friends, and this is not the first time we've been meeting each other at the WHO TWG platform, so I'll try to share my presentation now. I hope I'm gonna make it. Okay, tell me, please, because I don't see you now. Okay, yeah, that's perfect. Thank you. So amazing. So I'm not alone today. I am supported by regional coordinators, wonderful ladies from Dnipropetrovsk and Chernihiv regions. So I will try to use my 5 minutes. Each of us has 5 minutes. Okay. So what should I tell you now? So within the Mental Health National Program, How Are You? Upon the initiative of Lena Zlenska, First Lady of Ukraine. So we've been in it for 3 years already. We're discussing like the changes in the implementation process. The most important thing as we see it is that currently we finally have an understanding that mental health care, not only vulnerable groups must be covered, but each of us. And as we love to say that finally the care as a concept left the offices and now it's approaching the everyday life. When Katya said that they decided how to use the proper terminology, please, no discussions, no arguments. We have a barrierless guidance, as we call it, a manual where you can find all the glossary. Yes, elderly people. Yes, that's how we call it in Ukrainian. There's a fixed definition. There are options, but please use the proper one. So why do we talk about this mental health care, MH care. Elderly people quite often are the vulnerable category because all of us, we all have some stories, war-related experiences. Well, my presentation is not moving. Oh, yes. Now it's finally. Yeah. Yeah, yeah, yeah. There's some
починаємо з
dynamics.
питань.
Okay, amazing.
Сьогодні
But
ми говоримо про людей з
today we
тяжкою
did talk
віхою.
about
Це
elderly
9
people.
мільйонів
So 9
наших
million
старших. І
of
дослідження показали наші,
9
що
million people we have.
80% з них
80%
відчувають
of those,
тривогу
according to study,
більше
feel
половини
anxiety or
наодинці.
stress, and more than
Насправді,
half of these
мої колеги
live
поділяться
alone.
практичними
So
реалізаціями
my
своїх проєктів,
colleagues will
і вони
tell
розкажуть
about their
про
practices and
таку
projects. They
велику потребу,
will
запит
tell
про
that there is a
самотність
huge
людей
need and
старшого
demand
віку,
when it comes to single
ізоляцію,
elderly people,
особливо
that they feel
віддалених
isolated and
громадах.
abandoned, especially in remote
Ну,
communities.
де є точки
So,
входу для
the
людей
entry point
старшого віку?
concept for elderly people.
Я
Okay,
сюди навмисно не прибирала зі
where is
слайду
it?
школу,
I
тому що
didn't
нещодавно
take
ми
school away from
говорили
the slide because
з
recently we were
Міністерством
discussing
освіти
it with the
і
Ministry of
науки України.
Education
Вони
and
сказали,
Science.
що
So they
фокус на людей
told us
старшого
that
віку вони теж
focus on
мають
elderly
особливо
people, they also
психологи,
focus on them,
вчителі,
especially
тому що
school
ми знаємо, що
psychologists.
діток до
We know
дитятка до
that
школи водять
kids
їх
quite
бабусі і
often, who
дідусі,
brings kids
і
to
їм
schools?
потрібно, бо вони
Grandmas and
теж є
grandpas,
учасниками
respectively. They
навчально-виховного
are
процесу.
also the
Тому
parties to the
послуга
education
точки
process.
входу,
So the
доступу
entry
для людей
point
старшого
service
віку
itself for
є, в принципі, там, де
elderly
послуга є
people is
зрозумілою.
where the service is clear
Але
and
часто
understandable.
фахівці, які
But
надають ці
quite
послуги,
often,
вони там не
people,
готові до розмов
specialists
про
delivering
втрату,
services,
про
they're not
самотність,
ready
про
to
маркери
talk about
суїциду.
loss and
І як підтримувати
isolation and
користувача
single life. So
в
they don't know how to
контакті, особливо з
support
важким
the beneficiary
досвідом.
in contact,
Тому
especially with
ми дивимося
harsh
ширше
experience.
так на
So we
послуги. Ми
have a
говоримо
broader
про те, що насправді
perspective
воно не
when it
тільки в
comes to
лікарнях,
services. It's not just in the
бо в
hospital.
медикаментах
It's not
ментального
just delivered there.
здоров'я
In new
ми
mental health
говоримо про те,
centers,
що вони мають бути
we say that
різними.
these should be
Ну, сервіс
transversal.
з ментального
Okay,
здоров'я медичні
services,
все ви
mental health
знаєте.
services in
Ну, ми не
healthcare,
ділимо
we do not
сервіси для підлітків,
split
дітей,
services
там,
for
дорослих,
teens,
жінок,
kids,
чоловіків чи
adults,
старшого віку.
men,
Тут
women, or elderly.
загальна
So
рамка,
it's a
яка
general
працює на
framework.
все
It's an
населення
umbrella
України,
framework
тому що
working for all the
це
citizens
програма
of
в
Ukraine
межах
because
програми медичних
uh,
гарантій, філософія
under
якої є
PMG,
те, що допомога надається
this is
всім
delivered
рівно і
under
однаково,
PMG,
так?
so all
Але
care is provided
ми
equally to
говоримо про
everyone.
те, що
But what do we
фундаментально це
talk about? That
базова точка
fundamentally,
входу, і
this
ми
is the
знаємо про
basic,
лікарів
the
з
core
МХ
entry
ГЕП, ми
point. We
знаємо
know
про
about
центри
MH gap
ментального здоров'я,
doctors
ми
and
знаємо
mental health
про
centers are there,
мультидисциплінарні команди, які
multidisciplinary
також люди
teams,
старшого віку, особливо якщо
elderly
мають
people,
інвалідність або
especially those with disabilities
скажімо так,
or
складнощі зі
let's say
здоров'ям, то теж
difficulties,
можуть
health
отримати цю
issues, they
допомогу
actually can get that kind of
на
support
аутріч, як ми звикли
in
говорити.
outreach
В
format, as we
соціальній
call it.
сфері у нас
In
з'явилися
social
два
sector,
центри
we now have
життєстійкості,
these
і ми
resilience
бачимо,
centers,
що окрім
and we can see that apart from
вразливих так званих
vulnerable
категорій,
categories,
категорій
as we
соціальних
call them,
статей, які називають складні життєві обставини,
social
це теж
categories as
життєстійкі,
those in
вони
difficult
стали
life
своєрідними
circumstances,
хабами,
resilience centers
що
have become
поєднують
hubs,
людину з усіма секторами, залежно
merging
від її запиту.
various functions
Так,
and
і тут
delivering
є
various
допомога
services to
рідним
people
людям, бо
depending on
дуже
demand,
часто
like
ми це бачимо в громадах
peer-to-peer
невеличких,
concept. We can
як
see it in
амбасадори
small
здоров'я, коли
communities
люди
like health
старшого
ambassadors
віку
when elderly people,
піклуються
yeah,
про
when they take
інших людей
care of
старшого віку в
other
своїх
elderly
громадах,
people in their
вищодень,
communities of
які
their
там
peers, and they
виміряння
have these
артеріального тиску,
diaries, they
гуляють
measure
перед
the blood
сном.
pressure,
Так само
walks,
тут далі
evening
вони
walks, and
сервіси
so on.
ментального здоров'я в інших
Also, mental
сферах.
health
Ми
services in
знаємо,
other
що це
sectors as well.
спортивні
We know
секції,
that
скандинавська хода
sport
і так
clubs,
далі. Мої
Scandinavian
колеги більш детально
walking,
розкажуть,
and
які
my
вони
colleagues
придумали
will give some
класні
details
заходи для
about some
психосоціальної
great
підтримки своїх людей
events
старшого віку в
to support
областях.
MHPSS for
Також
their elderly
ми багато
beneficiaries in regions.
подорожуємо
So
по нашим
we
регіонам
travel a
і завжди
lot within
бачимо,
the
що це і
regions. We can always
танці, і
observe that
малювання, і
dancing,
різноманітні
art,
види творчості,
singing, I
які
don't know,
теж
various types of
підтримують людей
creative
старшого віку
activities are very
в
supportive for
такому
elderly people,
безкоштовному
keeping
психоемоційному стані,
them
який у них
like
зараз.
okay in this difficult
Що може
psycho-emotional
бути
environment.
корисним для вас як
What can be
надавачів
useful for
послуг?
you
Це
as service
наші працівники в
providers?
громадах,
So our
дипломатовані
community
сервіси, в тому числі для
maps,
людей
service
старшого
maps,
віку, бо вони
also for
є
elderly
не
people,
тільки там в
because
закладах охорони
these are not
здоров'я,
just in
соціальній
healthcare
сфері,
facilities and
бібліотеках,
social, but
різноманітних
sector also in
центрах, хабах і так
libraries and
далі.
various hub centers and
Подивитися,
whatnot. You can check
що
that.
є, як можна
So,
подивитися
how can we
послуги, які є,
check the
як можна
services that
шукати
are
послугу за
available? How
громадою, по
can you
категоріям,
search
тобто
it
фактично це
within
допоможе вам
categories, within communities?
проконтролювати
So, it
в
will
своєму
help you to
регіоні,
map in
подивитися,
your
куди ви
region
можете
to
чи
show
перескеровувати людину
uh,
старшого віку, чи
where you can
надати йому
refer the
таку
elderly person
інформацію про те,
or
які є
provide this
вільні послуги.
information, like which
Тому
services are
13
there.
тисяч я про це розповідала.
13,000, and
І
I told you about
буквально
that.
одна хвилина
So,
розкажу, які є
just for one
загальні
second, I'll
у
tell
нас
you what are the universal tools we have to share with your clients, with elderly clients? So, self-help first aid kit, as we call it, or a self-help kit. You can see it on the slide how it looks like. It's in free access in our portal. Like, I'll give you the QR code. So we also India Osvita platform, people with work experience. These are videos, a whole series of videos. So many of elderly people are waiting for their children, sons and daughters from the front line. You know, you need to understand how to communicate with sons and daughters, those who go to their parents when they're on leave. Yes, I leave it as a life hack for you. And also this chapter is there in communication in the manual. Fortunately, many of our defenders, men and women, we started bringing them back from Russia, from Russian territory. We, with experts, we designed this unique info box on how to communicate and interact with liberated captives. It's for them. But these videos, these are specifically for us, for service providers, and for your users as well. It will be really valuable. We understand that elderly people, they may not be willing to watch these videos. So there are some shorter videos where ex-captives explain some very simple things, what should be said, what shouldn't be said, how they are recovering, and so on. You can actually check what we have here in the info box for ex-captives, and I'm finalizing. I just put it in one slide because I don't have so much time. What we have, what should I recommend? So basic care skills, caring about yourself and others. So ethics of stress period interaction. If you have elderly people, if they have some high level of digital literacy, yeah, Better Me application. There's a whole course on stress management. And also special season of podcast Simple Words. Yes, second special season of podcast Resilience Science. And it's also important to disseminate it via resilience centers. This information, like how to consume news during the war without damaging your mental health. And this is really a very useful product, great product for elderly people because they, what actually, I told you, quite often they're abandoned, isolated, and they absorb negative news all the time. So you need to teach them, educate them how to consume news. And practical accommodations, mental health is like with illustrations. So all these products that I mentioned, you will be able to find these in our internet pages, the portal How Are You, and also the Facebook account. And I'm extremely grateful for attention. So I will pass the floor then to our regional coordinator of National Program, Mental Health Program in Dnipropetrovsk region, Miss Victoria Nazarenko. So I will share her presentation. Please, do you see the presentation? Tell me, because I need to know if it's technically okay. Katya, am I in the timing? Oh, yes, you are. You are still okay with the time? Hello? Anya, while you're sharing that, I'll start. I'll save time. My name is Victoria Nazarenko. I'm the regional coordinator of National Mental Health Program in Dnipropetrovsk region. So one of our prioritized projects for today in the region is Reintegration of Elderly People project. So when we were selecting the priority project for the region, we were arguing, defining who will be taken as priority, wanted to work with young people, with everybody. But why did we pick this category as elderly people? Victoria, I'm sorry, but Anna is showing a little bit like, okay, so the window, it's a wrong window. Excuse me, Victoria. Because we don't.
В PDF щось у мене воно не хоче. Якщо отак
Okay, let's do it like this.
і так, видно?
Yeah, amazing. It's there. Thank you. So, okay, the relevance. What is about the relevance? So we are the front bordering region, and we actually have many IDPs incoming, and let's say young people stay for a while in the territory and they continue migrating. Elderly people, let's say, they stay for a longer time here. You all know that we have internal evacuation. Many communities of our region are already being evacuated and relocated inside the region. And it's basically the same when elderly people stay, but younger, they move forward. So we had this problem that emerged there, you know? We saw this problem, like we asked ourselves how to work with elderly people. Why was it so, I don't know, problematic? Because as Miss Anna told in her presentation, elderly people, as a rule, if their relatives left and they stay like for the same place, they feel abandoned and alone, yes, and isolated. And they say, okay, we just wait to die, you know, and there's nothing else to do, nothing to expect. We don't have any more wishes. We don't want to get new social contacts. People were very pessimistic when we had this survey among elderly people. Okay, so we really wanted to implement this very ambitious project. We decided to do it. For us, it was very important to make sure that we can ensure this longevity and improved lifestyle with social activities. Also, organizing specific events and measures, outreach campaigns to engage them, strengthening cooperation between stakeholders and community from various sectors, various providers. This is very hard, you know, sometimes it is. So, promoting social integration, promoting improvement of the PSS, psychosocial condition, helping people to become self-sufficient. There are so many challenges for elderly people today. We even help to employ them if they were willing to. Anna, please. So, who's the target audience of the project? These are people of 60 plus age, but if people, a little bit younger people want to engage, like 50 plus, we never say no, we never decline. We say that, okay, merging people of different age categories, different generations actually gives very positive effects. So, in this slide, you can see the number of communities engaged to that project, 51. So the general number of communities we have in region 86, but we already have some of these evacuated. So currently, we are trying to keep the 51 that I mentioned in the project, and we're trying to expand the project scope. Okay, and the next one. So components of the project. The project itself was split in a couple of these. First one is social service delivery, supporting and integrating elderly people. It includes like various aspects. I will not read all of this. You will get the presentation later. I will just try to save time. Second, awareness raising and outreach, various campaigns. As practice shows, it's the hardest thing because info services are the hardest, and but still in the highest demand, and a lot of time it takes. The next component was training specialists because specialists must first be taught within so many programs. The next one is inter-agency cooperation in communities. It's a hard process. Again, it's hard because everyone is responsible for one scope, but merging that and showing a collective result is great. That was a hard task, but I guess, we're with baby steps, we're moving towards that and we're trying to settle it. Monitoring and assessment, this is the most pleasant part because I love visiting various groups, working in various communities, and later I will share some insights, practical insights, like what I observed there in these groups. Okay. The roadmap. So, roadmap is basically the stages of the project. It's our pathway,
Ну і цільові
project pathway.
показники.
Okay,
Ми
and the
запланували
target
і
indicator,
потрібно
something that we
досягли.
planned and
Чесно
something
кажучи,
that we
коли ми
managed
їх
to achieve.
планували, ми
So
ставили
when we
собі такі
planned
не дуже
these, we were
амбітні
setting
цифри,
not very
але за
ambitious
результатами якими
indicators,
ми
but
потім
based on the
підраховували,
results that we
відслідковували,
later
ми побачили, що
calculated and
дійсно цей
tracked,
проект
we
дуже
saw that
гарний і дає свої
this project
результати.
is super relevant and it
Ну
gives
і
some
зміни
results.
внаслідок
And
реалізації, які ми
changes due to
планували
the project,
побачити
something
для
that we plan
області,
to
для
see for the
населення.
region, for
Ну,
the
це
people.
покращення,
Of course,
це розширення мережі там соціальних служб,
expanding the
покращення
social
відділень
service
через
network,
взаємодії,
interagency cooperation,
зміцнення
improved
громад через активну
strengthening communities by
діяльність
active
забезпечення
integration of
відповідь.
elderly
Ну, це
people.
зрозуміло, да?
So
Ми ставили
it's
собі амбітні
clear.
цілі, і
So we were
фактично ми
setting
їх
ambitious goals and we
досягаємо. Наступне.
actually managed to achieve those.
Ну,
Okay, risks
ризики і
and
обмеження проекту. Без ризиків
limitations.
ніколи
Well,
ми не
without
можемо
risks,
розпочати ніякий
it's
проект.
impossible to
Ризики
start any
вони, у
project.
нас
And
були такі: це
risks,
низька обізнаність
so
населення,
low
тому що
awareness of
люди старшого
population,
віку, вони
because
не
these are
завжди
elderly
хочуть
people, not
долучатися до
always they
якихось
want to
інвестиційних
engage
проєктів
to
або
projects like
кампаній.
that or
Це обмежені
campaigns,
ресурси
limited
громад,
resources and
це
communities,
бюрократичні труднощі
bureaucratic
і логістичні
bottlenecks, and
обмеження.
logistic limitations.
Міжнародна підтримка
International
проекту.
support of the
Тут
project.
ми завдячуємо нашим
We are very grateful
партнерам
to
на
our
рівні
partners
області,
at the
які
level of
підтримали
region, those
даний проект
supporting the
і
project I talk
надали не
about,
просто
and
підтримку,
they
а
provided
працюють
not just the
з
support
дітьми старшого
itself,
віку.
but
Це
they work with
благодійний фонд
elderly people, charity
Прем'єр
fund,
Уржанс
Premier Urgence
Інтернаціонал. Я вибачаюсь, поки
International,
прочитаю.
sorry, maybe I
Caritas Україна,
misspelled it,
благодійний
Caritas
фонд
Ukraine, Right to Protection
Назад.
Charity Fund,
ООН в Україні,
UNDP
психічне
Ukraine,
здоров'я для України
MH4U, and
і
also
відділення
Polish
польського гуманітарного акції в
Humanitarian
Україні. На
Action in
сьогоднішній день знаю,
Ukraine.
що ще
So
додалися
currently,
деякі
I know that a
організації. Це
couple of
і
more
Червоний
organizations
Хрест
added.
України,
Red Cross, Ukrainian Red
і
Cross is there as well
Міжнародний
on
судний
board,
Червоний Хрест,
and International Red
які
Cross.
доєдналися до реалізації цього
They
проекту.
joined the project
Команда
as well.
проекту – це всі наші
The team of
департаменти,
project,
центри
all of our
соціальних служб,
departments,
центри надання
social
соціальних
service
послуг,
centers,
комунальні заклади
so municipal
різного
enterprises
рівня, і
of
як
various
обласний, так і
levels,
регіональні.
regional,
Дніпропетровський обласний центр,
also
спорт
Dnipropetrovsk
для всіх
Regional
наступний.
Center, sport for everyone.
Ну,
Okay.
тут реалізація
So
ми
the
пропустимо, вони
timeline,
нас виконують
basically,
цей
we'll skip
проект.
that. We're doing this. It's a pending, ongoing project.
Більш цікавого.
Okay, let's move to
Тут
something more
підсумкові показники,
interesting.
да, я
So,
говорила, що ми
final
перевищили
results.
навіть.
We've even overperformed at some
Запланували
point.
ми собі на
What we've planned
2026
for
рік
2026
продовжити цю роботу
to continue
і
this kind of activity and
поширювати
to
далі той досвід, який вже маємо.
share the experience
Наприклад,
we've managed to
ми
accumulate.
запланували собі
So
попрацювати з
we've
безбар'єрністю в
planned
громадах,
to
воно дуже
work
складно,
with
да?
barrier elimination in
І
communities.
результат реалізації проекту
It's
за
a
перший
problem.
квартал 26
And
року
the
у нас
first
на
quarter
сьогоднішній день такий.
2026,
Кількість
these are
громад
the results.
Дніпропетровщини, які провели вже активну роботу з ПТР,
Communities with
38
active work in the
територіальних
region,
громад.
38.
Кількість осіб
How many
старшого віку,
elderly
які були
people we
охоплені
managed to
послугами,
cover
це
with the
8832 особи.
almost 9,000 people were covered with
Найактивніші
our
громади
events.
це
Okay, so the most
Дніпровська,
active
Самарська,
communities
Перещепинська,
Dniprovska, Samarivska,
Могилинівська,
Pereshepinska,
Покровська,
Magdalenivska,
Саричанська,
Petrikivska,
Синельниківська,
Tsarichanska, Sinelnikivska,
Чернеччинська сільська.
Chernechynska communities.
Ключові активності.
Key
Я
activities.
тут уже, мабуть, трошечки від себе розкажу,
I
бо
think I'll tell a
активностей
little
насправді
bit
дуже багато,
because
і вони
we
дуже
had so many
цікаві.
activities, very
Я
interesting.
хотіла би
And
зазначити,
I would love to
підкреслити ті
note
інсайти, які
that
я
those
отримую, коли відвідую
insights I get
групи
every single
людей
time I
старшого
visit
віку.
elderly
В
groups.
в жовтих водах
In
працює
Жовті
група
Води, we have a
людей
group
старшого віку, де
of
вони
elderly people.
створили
They
місцевий
managed
хор.
to organize this choir, like local
Спочатку,
choir, you
коли я
know.
почала відвідувати
Initially, when
цей клуб, як вони називали,
this club,
людей
as they called it,
старшого
when
віку,
elderly people started visiting
їм
the
було
club,
важливо з того, що вони співають,
it was okay for them to
вони
just meet
залучали
and
всіх
sing, you
охочих,
know. They
там
were
відбувалися
inviting
різноманітні
everyone,
зустрічі,
various meetings were
запрошувались
there.
представники
They
різних
invited
надавачів,
different service
ознайомлювалися
providers.
з різними сервісами, які
They were
функціонують
familiarizing
в
with the
громаді.
available services.
І кожна така зустріч
And
завершувалася
every meeting,
написанням певних там пісень, частушок.
after
І
every
таких
meeting,
собі
some, I
дуже
don't know,
цікавих,
songs were
веселих
written
зібрань.
even, and some
Через
interesting
місяць, коли я
gatherings.
відвідувала
In
вже
a month,
групу,
when I visited this group
дивлюсь,
again,
люди
so
настільки стали
I saw that
активні, що вони
people
почали
were much more
прогнозувати, як
active.
вони
They
можуть
started
заробляти гроші.
forecasting. They started thinking how to make money, how to fundraise. Because, for example, their activity is very interesting for elderly people, for those who celebrate their birthdays. If they put an announcement about the choir, they can get some money, and they will make, I don't know, some costumes for that. So people are so engaged, they're so thrilled with that. They know how to use Facebook, they know how to use Facebook advertising. That was really interesting. That was such a great thing. You just realize that this that people can just sing, in a group, but it's something that keeps them together. It's like certain social glue. So they are willing to continue. Okay. I have so many of those insights, but I need to stop at this. Thank you.
Дякую дуже, Вікторія.
Thank you so much,
Теж
Victoria.
буду дуже коротко. Там на
And
презентації інсайти
I'll be
є.
brief.
Якщо
We have
кому
insights in the
цікаво
presentation. If you're
поспілкуватися,
interested, if
поговорити
someone
більше
is from
особисто, пані
Dnipropetrovsk
Вікторії.
region,
Я
you can
передаю
talk to
слово
Victoria.
нашій регіональній
Okay,
координаторці
and the floor goes
програми
to
ментального здоров'я та як у
our
Чернігівській
regional
області,
coordinator
Інна
in Chernihiv
Chystenko.
region,
Тому
Inna
слово тобі презентації.
Chystenko. Okay, and
Дякую. Я вітаю
your
всіх. Дуже
presentation.
приємно.
Greetings, ladies and gentlemen. It's so
Бачу
nice
знайомі.
to
Дивіться,
see
коли
some
ми знаємо,
familiar
то
faces
рада
even.
познайомитись
And
ближче.
those who are
Я
unfamiliar,
продовжу те,
okay,
про що
let's
розповідала
become
Віка.
ones. Okay, I'll just compliment Victoria because both our regions are covered by national How Are You MH program, an aspect of priority project for elderly people. Okay, so when we were discussing relevance, we have our own story. Thanks to coordination center of the CMU, so MH coordination center, they actually saw some potential in us. And I'm so grateful for helping us, for supporting, for giving some ideas. We've been active for a year as a project, and in fact, we can claim that we resumed the project and we already have some results, some achievements we'll be so happy to share actually. Yeah, so when initially we were analyzing the situation we had and something we would love to change, because social integration is the key, but how to make sure it's happening in small communities, where possibly there isn't any like network of social facilities, like how to raise awareness, how to actually inform people, notify people about that, how to unite, how to create a single ecosystem at some point. And the program is actually tasked to unite us, So we're trying to use this principle as a core principle. So what we're doing, like how it happened, and I'll tell about that. Okay, so we concentrated first and foremost on elderly people, of course, and we asked ourselves, like, okay, where do we have the entry point? Territorial centers, social service centers, resilience centers, because there were some activities before that, but with every single meeting, we were thinking initially that it's important to have some coordination meetings using the principle that we actually apply now within this meeting. So, and there are so many activities in communities. We are not always even aware. Sometimes in statistic reports, we miss those. If we go to a community directly, we can observe this or hear from someone about that. So I just want to focus on this. This is the first brief report we had like a year ago. So we wanted initially to unite all departments, have a working group there, because we do realize that engagement of everyone who's responsible for implementation, well, it will be much more effective if it has to be much more effective. So all departments were on board. So next step is notifying, informing about the activities that we already had in this profile. So we still collect these best cases, let's call it best cases or success cases, and selecting best of the best. Speaking about social experts and providers, well, so we had a huge focus on this case because Ms. Hanna spoke of this and Ms. Katarina as well. First, how do we talk about it? How do we communicate this? How do we articulate that? Okay? And let's ask ourselves, is it sounds okay? Does it sound okay for a person? Does the person feel highly functional? The age category is one, or social status, social position is one, named properly. So, the ship, when we build a ship, the name of the ship defines the movement. So, who was the stakeholder, the guide in the project? Department of Social Protection and also the Regional Center of Social Services. In the photo, I didn't want to take all of these photos away. So, beyond each of these photos, there's a lot of interaction and cooperation. You can see this was the meeting when we had heavy shellings, at that moment, and we had a challenge back then. So we asked people from the region, but we had no electric supply. It was really cold, but people came there for 3-4 hours. They drove just to come and tell us about their communities, what activities they have for elderly people, just to come to us. So we realized that these working groups, these already are the inspiration for the implementers, that there's no burnouts. So we continue with these meetings, and if you want to be engaged, please, you're invited. On a monthly basis, we can skip the slides. On a monthly basis, we had online, offline, hybrid activities. I'd like to separately stop at with this great project. When we asked the educators what would they love to introduce, because in schools, truly, in schools and kindergartens, there's a huge percent of elderly people taking care of like grandchildren, but to have elderly people as beneficiaries. And our regional methodological center, they engaged the preschool level and they launched the warm meeting project. Okay, these are some great activities where we tell about self-help techniques. We share some nice positive news. We tell about mental specificity of preschool kids. We understand that there are differences, generational differences. In this project, it grows and it inspires the specialists. We have a lot of great feedback. Maybe there will be a chance actually to show that. So we first of all talk about this, that an important component is the cooperation with you, our dearest partners. There's a bunch of organizations, Charity Fund, Right to Protection, Rokada, Caritas, of course. And these are the key partners, the core partners we implement the program with. So I definitely see some perspective in it, some potential for us to do it even more actively. And a photo. This photo actually shows a moment. It captured a moment when it's important to show your results, even if you're doing something great. But I've been in Ladanska community 3 hours from Chernihiv, but it's so worth visiting in it. When we came to community, they told us about Viktor, a man. You can see him in the photo with our consultant. This is Viktor, and he managed to gather more than 11,000 images of his community. For 9 years, he was actually doing that, He was just collecting photos, and now he shares these photos, and he made even a group for that. He said, okay, I now use computer confidently. I'm a confident user, so wow, that's a great example. So I invited him to give a speech during the meeting, just not for us to lecture people, to tell how we work with a category. Inspiration was super high. Now he is the star of community, a celebrity, and we have a whole line of people waiting to tell about their experience. And we can tell to region and to all the country. Thank you for attention. Colleagues, if you have any ideas, insights, results, if you're ready to integrate, or maybe your grandma, grandpa, someone lives in Chernihiv region, some of your relatives, elderly relatives, please tell us. We will take them on board. And thank you so much for this opportunity. Thank you for attention. Thank you. Thank you. Miss Anna, Victoria, Inna, thank you so much for joining us. Thank you so much for sharing some aspects related to regional activities. Okay, colleagues, really, I know they are so pleased to get it from you today, get some of your experience, because as I can see, that's quite a motivating and encouraging thing, just to observe the service beneficiaries and the local service delivery. This is really valuable. And upon the occasion, I'd like to encourage colleagues, please cooperate with the regional coordinators of the MH How Are You program, design new projects, and support the regional activities. It's super important when we are all together, when we work in a harmonized, unified way. Okay, we don't have time for questions, unfortunately, but maybe if colleagues have questions, we will send it to you specifically, directly, okay? Yeah. And now I would like to pass the floor to our next participant. And we will get a broader perspective in a presentation dedicated to global context. You know that in these meetings, these discussions, we try to use some international data and also Ukrainian topics as well. We try to go deep in various aspects. Fahmy Hanna, Dr. Fahmy Hanna, many of you know him very well, so I'd love you now to join us, who is the mental health specialist in WHO HQ. So he will tell us about some data, global data, and some of Ukrainian statistics and various framework aspects on how to help older adults. So please, you're welcome.
Katrina and colleagues, thank you so much, and thanks for the opportunity to zoom in on a topic which is very dear to my heart and all our hearts. I recall in my recent mission in Ukraine, in the east of Ukraine, when I was together with you, Katrina, around 2 weeks ago, and we were visiting east of Ukraine, various locations. And in one of the locations we visited that provide care for substance use, we have met a lady who is above 65 years old, and she explained to us that she feel in the center lonely and feel also alienated by the MHPSS intervention provided to her. She feel that the services provided to her were not adapted to her age. I think that stayed in my mind, and that's the focus I'd like to zoom in this presentation. You would notice I used here the term older adults instead of elderly people, and WHO and the United Nations in general prefer to use older adults because we believe elderly is a term that causes ageism, and we will come to that in the next slide. Colleagues, do you think older adults have more or less mental disorders compared to the general population? According to WHO statistics, 14% of adults aged 60 plus live with a mental disorder. Against a common misconception, mental health conditions are not inevitable consequence of aging. The prevalence of mental disorder among older adults, this 14%, is comparable to what we see across the broader adult population. However, older adults face specific additional barriers related to recognition, diagnosis, and care. In many situations, unfortunately, it's related to the dual stigma, not only of having a mental disorder, but of also blaming it to their age. You hear common phrases. One of them is actually labeling as elderly, which is very much a term linked in English language to senility and labeling people because of their age. That's why we prefer older adults. Or saying common phrases, which are ageist phrases, discriminatory, such as, what do you expect at this age? This is just normal aging. This is not a mental health condition. Older people don't use technology, try to put a general assumption. They are all lonely. They have had their life. In humanitarian settings, also, we hear the term used for older adults, labeling them as the most vulnerable, which is, again, not acceptable term. Or they are a burden on caregivers, which, again, is not an acceptable term. Instead, we recommend using this terminology because words matter, especially when it comes to mental health. Older adults with diverse strengths, capacities, and needs, older adults at increased risk of exclusion, older adults and their caregiver, older adults as contributor to family and community resilience. Same with dementia. We need to avoid using terms such as demented people, such as senile, such as losing their minds. We need to replace with people first language, as we do exactly in mental health condition. Person living with dementia, person with cognitive impairment. I think words really matter, and that's not only for general mental health conditions. That's include also for older adults. 7% can have depression, 3.8% may have an anxiety. And as you know, the world is aging, and will come specifically because that is specific concern to people in need of humanitarian assistance in Ukraine and in Ukraine in general. 1 in 6 may experience elder abuse. Many of these statistics and facts are included in the WHO fact sheet on older adults' mental health, which is up to date, was just updated the end of last year, and I'll share with you the link for it. WHO also have a dedicated fact sheet that includes statistics and interventions for older adults' abuse. And I want here to highlight that, like all mental health and psychosocial issues, this is a cross-cutting issue across sectors. So when we talk about abuse, that means this is not only for health sector. Protection can play a critical role, and GBV actors can play a critical role when we talk about mental health consequences of older adults' abuse. Next, please. Colleagues, in the previous slides, we introduced some statistics, the 7% and 3.6% for depression and for anxiety. But as I mentioned in the example I started my presentation with, substance use cannot be overlooked. And part also of looking at mental health needs of older adults, commonly we see substance use is overlooked. Actually, commonly also we see suicide being overlooked, while actually 25% of deaths by suicide come within this age group. There are lots of misconception, and when mental health and psychosocial support actors like yourself, and I'm so impressed with what I hear from the Mental Health Coordination Center, need to address all this misconception. Colleagues, mental health conditions in older adults can be easily overlooked because depression and anxiety may not present obviously as sad or low mood, or anxiety as fear, but rather actually as fatigue and physical symptoms such as sleep problems, several physical complaints, including, for example, stomach ache, irritable bowel, social withdrawal, loss of confidence, increased dependence on other. Substance use disorder and harmful use of medication is common in this age group, and commonly unrecognized because healthcare worker and social worker overlook asking about them in this age group because of stigma issue. They are intimidated to ask about substance use when they meet an older male or female. Colleagues, also for older adults living with dementia, the impact of war and displacement can be particularly severe. Dementia already affects memory and orientation and communication with people and ability to cope with change. And conflict can suddenly remove familiar people around a person living with dementia, remove places and routines, which are the familiar and familiar objects. And air raid siren can cause more confusion in a person living with dementia than others. The family separation, the disrupted care, the repeated exposure to frightening events can really cause agitation and can increase wandering among people with dementia and sleep disturbance. In this slide, I want us to remember depression and anxiety and suicide risk in older adults frequently hidden behind physical complaints, isolation, and functional decline. And around a quarter of deaths from suicide and self-harm globally occur in this age group. And the experience of war for people living with dementia can lead to more confusion and exaggeration of dementia symptoms. Next, please. Colleagues, HelpAge International last year have conducted a very useful survey around mental health needs and also physical health needs of older adults in Ukraine. And the numbers are really striking. So 24 to 25% of Ukrainian population is aged above 60. This is a piece of statistics that may be known to many of you. But when it comes to the PIN, population in need of humanitarian assistance, third of the PIN is among this age group. If our interventions are missing older adults, that means we are missing third of people that humanitarian actors identify as in need for humanitarian intervention. Another statistics which is quite eye-opener here is that third of civilian injuries and half of civilian deaths during war, as reported back in 2025, were among these population groups for various factors, such as mobility limitation, limitation in using technology, which can threat when there is a danger coming, chronic health condition, refusal to move from sites, delay in moving to shelter, dependent on local network and social support that may not exist if there is an evacuation of a certain location. Quite remarkable that half of this, you can go to the next. Thank you, Katrina. HelpAge International also provided us with some of the drivers for mental health and psychosocial needs among this population group. As we mentioned, some of this is related to digital and access barriers, but financial stress was quite a driver for depression and anxiety. Significant statistics here related to access to basic needs, including food affordability, and you can see a figure here of 88% cannot afford medication out of pocket. Social isolation, the more we go with age, the more in this HelpAge International survey, the more we find that there is isolation. 51% live alone of people above 70 and 31% of people above 60, which is quite a remarkable figure again. Loss and bereavement. Bereavement, when there is loss of children, then there is loss of friends, then there is movement from neighborhood is among the driving factors of mental health and psychosocial needs in this group. Next, please. We need to remember that suicide rates and substance use rates in general in many oblasts across Ukraine are higher than general population, and particularly in this age group, as we said before, it's overlooked and do exist in this age group, both suicide and substance use. Older women has reported more mental health and psychosocial needs and complain compared to men. It's closer to 70%. Has reported at least one mental health and psychosocial needs compared to 52% among men. Disability is a key factor, and I'm aware that the MHPSS Technical Working Group has conducted trainings on disability inclusion of MHPSS. I want to remind us all that disability inclusion does not mean only children. When we think of disability, majority either think of children or think of veterans, but this is third of people in need of humanitarian assistance affected by displacement, and 27% of them has physical disabilities. There are many factors related to barriers to accessing mental health care. Not only stigma and ageism, which led to many mental health actors would label around the world people, older adults, their mental health needs as being related to age. However, one of the challenges we have in the MHPSS community is limited availability of age-sensitive MHPSS services. And when we speak about age-sensitive MHPSS services in all humanitarian interventions for MHPSS around the world, we see child-friendly spaces, youth activities, parenting and caregiver groups, women support group, but rarely you find mental health and psychosocial support activity targeting older adults when it comes to grief, depression, loneliness, and anxiety, particularly for this group or adapted for this group. You can find many mental health intervention using smartphone, using QR code, accessing Telegram channel, which gives psychoeducation, but many of this does not put the visual impairment, the cognitive difficulties, the low digital literacy, or actually no internet access for many older adults. Also group interventions that are held in an accessible place. For example, in the third floor without an elevator, an MHPSS group activity. So immediately older adults with physical disability, which we see here is 27% cannot have access. You find screening for mental health and psychosocial needs that would exclude immediately cognitive impairment and dementia. And you look at many assessments around the world, you find that the assessment does not specifically include this age group, but include actually children, women, but excludes this age group. Same for livelihood program. Majority of livelihood program are designed around the world for 18 to 59 and excludes this particular age group, which actually, as you see, one of the driving factors of depression and anxiety is financial distress. Next, please. There are a number of resources, and the good news is that the MHPSS Technical Working Group in Ukraine and WHO Ukraine Country Office has been very active in translating these resources whenever they come from WHO into Ukrainian. So colleagues, iSupport for Dementia is a self-care tool for caregivers, for people living with dementia, available in this QR code in Ukrainian language. You'll find actually on WHO website, there is a dementia portal with numerous resources, but this one can be used by MHPSS actors for self-care, and is the equivalent of doing what matters in times of threat, but for caregivers of dementia. MHGAP Humanitarian Intervention Guide, which is available in Ukrainian, include also specific modules on grief, available in Ukrainian. As we mentioned, one of the main driving factors is bereavement and grief in this age group. Again, available in Ukrainian, a tool that was developed by the IC MHPSS reference group titled Living with the Times. We tested around the world with many older adults during COVID times, and we find a simple game can be used for psychoeducation. So we linked the diagrams, which were designed also in easy to read format. These posters that help older adults is not only useful for COVID, but can be used in wide range of stress management among this age group. As I mentioned, many of the statistics I shared with you is in a fact sheet for mental health of older adults, and I think you can use this for educating caregivers and for educating your teams as well on the various statistics and intervention and approaches by WHO for this age group. And finally, the disability and MHPSS inclusion guidance note from the IC, again available in Ukrainian on the final QR code. Next. Katrina and colleagues, these are thoughts from my side for what the MHPSS technical working group can do. I think you are exactly doing the right things by having a dedicated session like today for this group that is classically a humanitarian blind spot, unfortunately, around the world. So I think Ukraine is changing the narrative. Keep this discussion, keep this zoom ins, because I think it's needed if this group represent third of people in need of humanitarian assistance and half of all deaths during the war. Also, coming 1st October can be a good opportunity to engage with older adults themselves at many sites, at several oblasts, building on the wide network of coordinators you have including at local level, to engage with them and have events being reported to the National MHPSS Technical Working Group about older adults engagement as well as their caregiver. Make sure not only NGOs but also persons with lived experience among older adults are represented in this group. Make sure that the available interventions have capacity building initiatives, whether it's I support or whether it is Living the Times or any of the resources we have, including MHGAP grief module. Make sure that respondents at front lines and in the field are equipped with skill to roll out what we shared in the previous slide. Make sure that the technical working group, including the regional group and coordinators as well, have a database of older adults who are in far and remote areas or who are lonely. WHO at global level actually is having now a committee against loneliness, because we discover this is a risk factor for many illness. It's not only war, but aspects such as loneliness that can exaggerate chronic illness which exists, and definitely mental illness where depression and anxiety, social factors can play a critical role. I'll stop here and thank you so much, Katrina. Thank you so much, Victor, and all the MHPSS TWG members for making this topic a priority, because it is, if we look at the statistics.
Дякуємо дуже.
Thank you so much, Dr. Fahmy. Thank you for giving us some guidelines.
Можливо, я думаю, що проблема, скоріше,
I
в
guess
каналі або що.
maybe it's with the channel or something else. So colleagues, do you get the sound well? Yeah, amazing. Yeah, thank you. Maybe something was with the translation. Okay. So thank you so much, Dr. Fahmy. Thank you for giving us some really valuable ideas and insights. Our colleagues are taking notes and recommendations. We will try to implement this. And I think that this is so valuable. This is so great that we have such a huge amount of data and information we can use as a background for our activities. And it's so important to, of course, draw attention to older adults group, because unfortunately, as we heard initially, they're one of the groups that is often ignored or left beyond, unfortunately. Okay, and I'm so pleased that this meeting goes in such a productive way. We are discussing the activities, and we can pass the floor to Oleksandra now, who is the coordinator of TWG on age and disability. HelpAge, yes, she's representing HelpAge International. She'll share some solutions and approaches on how you actually help the older adults. Oleksandra, thank you so much, and I pass the floor to you. Ms. Katrina, thank you for inviting. I was taking notes, and I want to steal some of your speakers to our group meeting. Okay. Because, yes, I'm a tricky person. I'll help my colleagues with I'll ask you to help with the presentation. So I represent the TWG on age and disability under protection cluster and led by HelpAge. When we talk about psychosocial support PSS, we talk about these practices we can implement under protection cluster, no other levels. And the next slide. Okay, relevance. I've heard a couple of times that approximately 1/4 of Ukrainians are 60+ people. So when we take the general statistics, we take the forecast that up to by 2030, globally, the share of older adults in the world will be higher. So Ukraine has already been there for years in this zone, let's say. These 24-25% we discussed, the data we had even before 2022. And currently, it even increased. The share increased because many young people left the country due to hostilities. When we talk about older adults, and we heard that already, so this is stigmatization and self-stigmatization of older adults. And our colleagues gave some examples, like, I will die soon, why should I ask for help? They tend to think when any like no anxiety, depression, everybody says, oh, it's your age, you're like 60, 70, 80, like what did you expect? I just want to tell you that we all have bias, okay? And towards certain groups, we don't live in a vacuum. Unfortunately, we all are biased at some point. The world beyond the bubble exists, and the best thing we can do is to realize, how do we think? Also, the mental health issue itself is tabooed. We talk about that. Recently it has become better, but we still have this background in the post-Soviet environment, so the punitive psychiatry. When we speak about PSS, MHPSS, when we just discuss psychologist support, quite often the first association people have punitive psychiatry, especially when we talk about older adults, because for some of them it actually happened when they were citizens of the USSR. Also, multiple risks of war that may be combined with certain physiological specificities of older adults. Dementia is not normal for older adults. So it happens so that nervous system is evolving in that way. It's okay. We have to consider that. But so unfortunately in Ukraine, these specificities of nervous system are not taken as a norm, or vice versa. Dementia, which is not a physiological norm, is taken as something complementing an age, manifestation of age, which is not there. When we talk about the relevance of PSS services, we are backed by those studies we have. Like the previous speaker told us about HelpAge survey of the National Assembly of People with Disabilities. Yes, still humanitarian needs are dominating. Previous speakers told us that financial stress, inability to provide for yourself, but this is like a snowball principle. These basic needs are not covered, and it leads to aggravated psycho-emotional condition. So that's what we stand on. Okay, so when we discuss barriers and challenges in the context of PSS and humanitarian response in general, we understand that older adults are still not visible enough. So much of HNRP and older adults are still mentioned, but anyway, we're at the level when we mention this category only on paper. We don't adapt, we don't engage older adults to consultation, to decision making. Still, it's a problem, yes. For us humanitarian responders, we want to do some good, but we don't ask people what they need. Okay? As we mentioned before, stigmatization of mental health. When we discuss this experience of older adults, those with punitive psychiatry and all those stereotypes, negative experience, all the myths and bias, we understand that even the very definition we use as humanitarians, the terminology PSS, well, it may be unclear because quite often it sounds very technical. We think it's clear for people, but it also can lead to bias. Even if the support is okay for the person, one would like it, but people are ignorant. They hesitate because they think this is something bad, this is something shameful. Also, we mentioned the lack of specialists. When we speak about staff deficit, the understanding of how to handle older adults, how to be sensitive enough to their needs, how to act when chronic diseases can be combined with age or disability, certain type of disability. What can we do when this is not officially recognized disability, okay? And also poor access to services. It's not just lack of architectural access and accessibility, ramps, for example, but remote areas, that's what I mean. Digitalization, if these locations are not covered by the network or when we announce our services in Telegram groups, but person may have like an old Nokia, but Nokia. So like compared, we have fewer of those people compared to 5 years ago, but we still have them. We have to remember. We cannot ignore them just because, we think that we all are super digitalized. And when we talk about low access to services, we talk about our glossary. How do we communicate things, okay? Our language. Some of our people, when they talk to older adults, we start shouting because we think by default that older adults don't hear us very well. Quite often when we shout, we sound very commanding. And older adults, for them, it's harder to perceive that tone of voice. Yes, this is their specificity. Basically, we as TWG on age and disability, what can we do? Where can we help? And we'll be happy to join. So trainings on communicating with older adults, on what is healthy aging, access, inclusion, inclusive programming, or basically anything you want, anything that is relevant. We have a great specialist who runs great trainings. I love these. So please ask if you need. Advocating. When we talk about some program design, also HNRP. When we talk about consultations before we apply for grants, okay, we can become those people who will ask the uncomfortable questions and who will instigate that. Not what can be done, but how it can be done. And we also target ourselves at shifting the focus from vulnerability to human-centered approach. When we talk about shifted focus, so this is our stereotypical idea. We can automatically, all people 60 plus, we can automatically label them as vulnerable, okay? And our actions, our interventions initially designed in a wrong way, okay? So our interventions are very paternalistic at some point, yes? Instead of perceiving an older adult as an active rights holder, active participant of the process, and we try to advocate this and pay more attention and like recommend what should be done in a better way. Okay, now we step to projects, HelpAge projects. The key principles used by HelpAge in implementation of programs, and also some successful stories, cases. One of the first things for us is integration of PSS in humanitarian programs, meaning that when we draft an application, it's already there. Trainings for frontline responders. On basic checklist, like how to consult a person, where one can find services, how to understand that person is stressed. It should not happen in isolation. Group activities, because one of those risks we actually mentioned is isolation after relocation. Isolation because relatives may be deceased or they left the country or at the front line or may be missing, which is also a trigger. Even if a person lived in a village for 60 years, and one only was arguing with a neighbor because of some, I don't know, because of some minor things, it was a safe zone. When we relocate a person to a safer place, physically safer, but what's next? The question. In our projects, we try to remember about mobile formats and field formats. Locations for activities, for services may be logistically unavailable. These may be in remote communities. In those communities where transportation is too expensive, unavailable, you will not be surprised. The minimum pension in Ukraine is 2.6 thousand hryvnias, which is very sad. Also, developing capacity of local organizations, of communities in general. Why? We know projects have deadlines. They may be over. Someday we will leave the communities. Just like now, many organizations leave central, western regions because of limited funding. Why do we talk about local potential increasing? Our task is when we leave. What is the task? For the support to stay. For people in community to be able to get the support, for us not just to beautifully put it in the report, but actually to have this large-scale outcome. The most successful cases from HelpAge. First one, creating safe spaces for people of older age and initiative groups establishing. They had psychologist sessions, yoga, Scandinavian walking, any activity that was really interesting for them. So we focused on this. Not just to bring people who are relocated in this program, but also locals of the host community. Because another humanitarian response challenge we have now is that the majority of humanitarian programs, they want to target at IDPs. And this is a problem because it's like with our positive intentions, we create additional stigma for them. With HelpAge projects, let's say activity in Lviv, Chernihiv regions, it stopped in 2026, but initiative groups, safe spaces still function. One of initiative groups registered as NGO, and they are still functional. They're still operating, so which is a great thing. This is about sustainability. Peer-to-peer approach. Some of our social specialists, these are people who previously were the beneficiaries. And after that, they decided that it would be interesting for them to try it. 60 plus people who also provide their services of social support and social follow-up to their peers, okay? Not just about basic support, but about communication and about understanding. These were the project beneficiaries before, so people who are current beneficiaries understand that, okay, it can happen like that, okay? Integration in social services and other programs. I guess that was the very last piece, yes. So our contacts. We have the page of the Relief Web. You can sign up. Please contact me or our advisor on age inclusion, and we will be extremely happy to engage because what I heard from you is super valuable. I will return to my colleagues I will take contact some of you today. Okay. Thank you, Miss Oleksandra. Yes, this is so great when within these meetings we have a chance to expand networks and connect because, a lot of things are done. And especially in TWG, we have so many people here, various activities, and it's so great that everybody can be aware of that. Thank you so much for the presentation, and I'm so interested in your project. You use the peer-to-peer approach, as for MHPSS, this is highly promoted for many groups of population, veterans, service providers themselves, and people living with HIV. So, like almost all the categories, they have certain programs and it's important to make sure that this service delivery format is developed. We'll be so interested in further conversations. and discuss it.
Власне, на цьому дуже вам
So
дякую.
with that, I'm
Ми
extremely
закінчимо
grateful.
нашу співпрацю з
We
таким
really
форматом. Дуже цікаві
appreciate
та інформативні.
cooperation
Бачите, що мої
with your
колеги вже поділилися вашими
TWG.
контактами і підпискою на розсилку.
And yes, thank you
Щодо
for
новин,
telling
власне,
us
та
about
нагадую, що
your
технічні
newsletter
робочі
and
групи з питань
contacts.
вікової інвалідності
TWG
пов'язані
on Age and
виходить
Disability, they
розсилка,
have
яка містить дуже
a
багато
regular newsletter
цінних
where,
матеріалів
well,
та
it contains
публікацій
a lot of
саме з цієї тематики.
publications,
Тож запрошую
materials on
колег
this topic,
долучатися
so
і
please,
відслідковувати. Вважаю, що це дуже корисно та
please
цінно.
check. I think it will be
І, власне,
super
знову ж
helpful for
таки,
you.
хочу відзначити, що в нас
I just want to note that in our discussion today, all aspects are tightly intertwined, tightly connected. And I think that all our speakers mentioned the problems of handling the people with dementia, older adults with dementia. Yes, we cannot talk about older adults and miss this specific subcategory. Supporting people with dementia and their families, that's very important. We're so happy. We have Anna Kovalenko, Manager of Mental Health Projects in Nezabutni Charity Fund. Anna, thank you so much. I'm so happy to see you. You were at other events we were organizing related to disability and inclusion. And I'm so happy to ask you now, please tell us about patients with dementia, okay? Great.
Thank you, Katarina. Thank you
Thank
so
you so
much for
much.
the invitation. I'm so glad to see a lot of familiar and not very familiar faces. It makes me very happy, actually, that colleagues and Dr. Hanna and Oleksandra, they truly remembered with high importance the topic of dementia, because when we speak about the elderly people, actually it is impossible simply to take and bypass this situation, because, you know, age, if the person is older than 65, then this is one of the biggest risk factors for dementia development, and this risk factor for dementia development cannot be dealt with because the person is getting older no matter what. But anyway, as the state, as people working in mental health, and dementia is a part of mental health, we can work to reduce the risk for the development of dementia, first of all, and secondly, to support people who already faced that, as much as the modern science can help us do that. So I would like to tell you more about that these days. So the organization I represent right now is named the Charity Foundation Nezabutni. We've been working from 2021. That's why we're quite a new organization, and we work to support people with dementia and their families directly. I mean, we provide psychological aid, legal aid, care, information support. We also provide advocacy and the development of the society, which is friendly to people with dementia. We also do the trainings and the researches and participate in the international programs. So what is it that I'd like to say? Something that my colleagues have mentioned. Dementia is not just neurological problem, and dementia changes not just the memory. So this is a group, this is the group of symptoms that impact in general mental health of the person and the emotional and cognitive status, and also partly relationships, identity, social role of the person. And you know, when dementia progresses, it neurodevelopmental disease, and when it progresses, the problem in psychosocial support increases, and it touches not only the person with the dementia, but also the family and people around supporting the person with dementia. The biggest responsibility for taking care of the person with dementia is on the family. The problem stays invisible for the system itself. So what does it mean? I can give you a very simple case. If you look at the official statistics in Ukraine, more than 100 cases were diagnosed, but knowing that dementia is still underdiagnosed in Ukraine and in general worldwide, the assessment of our partners, Alzheimer Europe, which were conducted last year, say that it is more realistic that in Ukraine we have more than 600,000 people with dementia, and even more those who take care of these persons and those who are affected due to that. As colleagues have said, the war exacerbates the situation. Stress does not cause dementia itself. There are so many cases that we faced which say that stress, evacuation, the loss of the environment, grief, forced isolation, relocation, all of that may trigger, and people start noticing the first symptoms of dementia or the sudden and abrupt deterioration of the condition for people living with dementia. All in all, what we can do and what we've noticed works in our work. Most formats that we had, they are adapted to the conditions of the full-scale invasion. Most services are available online without the attachment to the specific location. But anyway, we try to have the local offline events. And Oleksandra before me said that for people who are elderly and for their relatives and close ones, accessibility is not just an empty word. Accessibility, I mean, in terms of the digital. Sorry, I'm losing my words. So, anyway, digital literacy. Yes, thank you so much. I remembered the word literacy, but failed to remember digital. So that also has its impact. That's why, although we provide a lot of services online, we're trying to have the simple ways. Well, that's why we have the hotline. A lot of the services are provided by the hotline. We have the hotline named Nezabutni that supports people and families of persons with dementia. That works thanks to the team volunteers who are the caregivers, and they were our beneficiaries early on, and some of them also want to support others. Also, we have the support groups, peer-to-peer support groups, although they are moderated by psychologists. But anyway, these are the peer-to-peer support groups for the caregivers. Also, we have the empathy program for the caregivers of persons with dementia, and also individual support for caregivers and for people with dementia. We have Memory Cafe and for their caregivers. So although we tried to have the online events as well, but it also worked well. Apart from that, we also have training programs for the caregivers who also have psycho-emotional component in them. The harder we work, the more we understand that supporting people who take care of people with dementia, no training program is possible without psychoeducation, psycho-emotional component, and very often at the same time, when people at first ask for psycho-emotional support, they anyway have questions which require more consultations, education, and awareness raising. And it happened in a way that in these directions, I work for a reason. So what helps people with dementia? There is one great format that a lot of colleagues know about. That is the format that is named Memory Cafe. And these are regular informal meetings for people with dementia and their families, for the volunteers. So what does it look like? It looks like a little holiday by itself where people do some creative arts and they spend time together, and it works. First of all, because the social isolation is one of the key factors of deterioration of condition in dementia. If we remember stigmatization, self-stigmatization, the risks for isolation increases in this case. Such events, they create the environment where the person with dementia stays a participant, not a patient. And It boosts mood at the same time, reduces anxiety, and at times you can relax, get distracted from the situation. I will put it simply, but for people with dementia, it is so important to engage with others in the society, and it boosts mood. It is a big event because this is the reason for them to get dressed, to smile, to simply dress up and get distracted from routine activities and not get encapsulated in that. Let me also tell you about our program on nonviolence communication that is named Empathy. And this program is not about dementia itself, it's more about caregivers and how they can use their inner resources and work with their inner needs and feelings, and this way prevent burnout, because we know that emotional regulation of the caregiver directly impacts the quality of care and the quality of life of the family and the quality of life of the person with dementia. And the impact is confirmed with the feedback. The participants, they identify the changes in self-perception. And always with colleagues, we insist that, yes, dementia changes the lives, dementia in life changes it, but it shouldn't identify it. And the fact that, for example, you add the situation where it's important to take care of the person. Dementia changes communication, but it shouldn't change relationships. And the program of non-violent communication help people in communication, and the communication gets more difficult due to the fact that the person has dementia, so that people would be able to support their relationships regardless of the dementia progressing. So why do I say so much about caregivers, not that much about persons with dementia? You know, for a lot of people with dementia, still, a caregiver is the entry point that helps us understand the needs of the whole family that faced dementia. As I said, the condition of the caregiver directly impacts the condition of the person with dementia. And the full-scale invasion and the whole stress of war, on top of that, strengthens all the stresses that families with persons with dementia face. Also, there are challenges on top of that. I mean, how we can provide the support, and we have not a very big team. So there are some situations where we also need the support, and very often we don't know. We don't know about all the people with dementia who need care, who need support, and thus all the families who face dementia, they don't know that they can get specialized care. And the organizations, our partners, doctors, very often they don't know that it is possible to refer their patients to us, and this way they will get the support not just from the doctors, but also, let's say, from the foundation. And they, what's more important, they can communicate with the like-minded people, people who face similar challenges. And very often, both the medical staff and social workers have no chance to provide good quality care to people with dementia. They cannot provide hints to their relatives and loved ones due to the lack of time and lack of resources. So in terms of the dementia prevention that I started speaking early on about, we know that up to 45% of cases with dementia could be potentially prevented via management of the risk factors. And right now we're actively working on awareness raising and working with healthcare workers, primary medical and psychosocial support. Recently, we've started the pilot training for doctors of the primary healthcare level on early identification, detection, and counseling, both in terms of prevention and in general communication with people with dementia. Because regardless the fact that a lot of people, a lot of the primary healthcare staff, thanks to the partnership activity that you are all a part of, the healthcare workers finished MH gap training. Anyway, they have a lot of different questions, and it's great when a doctor may not just suspect and diagnose dementia, but also be the first support person for the family that got such a diagnosis for one of the family members as dementia. And of course, the family has a lot of questions as a result of that. Next slide, please. So we would also like to offer you to work together with us and to be our partners about that, because we can both run the trainings for the staff, social workers, humanitarian workers on how to detect symptoms, communicate basic approaches to people with dementia and their loved ones and relatives and family. Apart from that, it's important to mention that my colleagues, together with Oleksandra Kovalenko and the technical working group on age and disability last month, they worked on inclusion of dementia to humanitarian response. That's why we do hope that soon the recommendations will be published, the recommendations we worked on together, and we are always glad to have the joint projects and activities, because I know that together we can do way more than on our own to support people with dementia and their families and loved ones in Ukraine. Please follow this link and QR code to receive the access to the guidebooks and memo developed by the charity foundation Nezabutni. It's about the prevention of dementia and in general basic awareness, legal aspects, and how to take care of person with dementia. And also you can see the recommendations to post something in social media and how to talk about people with dementia in daily life. Thank you for your attention. I hope I didn't take too much of your time, so feel free to take my information, contact information from the chat. Feel free to ask questions. I'm always here to answer them. Thank you so much, Anna. And we congratulate the Charity Foundation with so many important activities. Really, your numbers are so impressive. And I think that it's so important that in Ukraine we have the organization that is working on dementia, since, yes, as all the speakers mentioned today, this is a very relevant point. And let me repeat and say, I will not repeat and say all these numbers, but it is so important for us to have these services accessible. Dear colleagues, please do look at all these helpful materials and build the partnership with the Charity Foundation Nezabutni. In my opinion, their activity is so valuable, needed, and important for actually all of us as actors engaged as both to humanitarian response and recovery and building up the system on mental health in Ukraine. Unfortunately, then again, we do not have any time for questions, but it seems to me that colleagues really are so interested, and I encourage all of you to share questions with us or contact Anna to communicate. And now I would like, lastly, to give the floor to Viktor Vus, who is the co-head of the technical working group on mental health and psychosocial support on the national level from IMC, to sum up the meeting and to share reflections with us. Viktor, over to you. Thank you so much. I understand that we've run out of time, but well, this is the times we live in. That's why we move accordingly. Today, we've heard so many different speeches, so many different organizations and forms of work, but this is not simply a chaotic work. This is the comprehensive work, all the directions, all these things, they are united. And we can speak about the international global standards. So Fahmy Hanna said about these standards, and we could see how the national framework works, how our national system is being built. It was the speech of the technical working group of the Coordination Center for Mental Health under the Cabinet of Ministers. We could see that on the level of the organization of civil society, on the level of organizations, we could see how the work and support is provided. We could see that on different levels, differently, people work, and I want to thank all the speakers for all of that. And also it's important to say that this highly valuable experience, I mean, the more we know everything, the more we understand the situation. So this is a so-called roadmap, which tells us who does what and where and when, of course. And also, I would like to say one more point. It was mentioned here, but not very much, about researches and studies. This roadmap, you know, this menu of care for people who are elderly, like we should also keep an eye on the research and studies. Cooperation with academia is really important. I know that HelpAge, together with I Hope, ran a global study and research where Ukraine was also represented partly, and they made the presentation in January or February according to the results. And there were really interesting results shared, and it's important to look at that. And I think that Anna, Kovalenko, and Oleksandra will be able to share all of that. Also, it's important to say that Inna, for example, Chystenko, she said about the form of work with persons, with the elderly persons. But let me put my 2 cents in. When we jointly together with Inna went with the visit to the pre-frontline community, borderline community, Grodnya, we could see the inspiration of people and different forms of work, showing how to work with persons, with the elderly person, using different dancing activities, working in the garden and vegetable garden. So, you know, a lot of different forms are available. You should see how the person who is 70 trains others how to dance for peers. Like, it was unbelievable. It was so inspiring to see that. So in the communities, you can also organize that and see that this work was not just in one building, in different offices. It was in the library via the integration of all these components, different areas to help persons, the elderly persons. So how to engage persons, how to engage them. A lot's been said about stigmatization and taboo and lack of access to the services. So then again, out of the experience of cooperation and work, I can say what's been said by consultants of Chernihiv Oblast from Chystenko, that it is important not just to share information, but people need to get clarified information on how it's done. For example, in Cherkasy region, there are proactive hotlines doing that, and it was highlighted from the consultants. There was a request that we need to run lessons learned so that we would explain others how it works. Whew, I think that I've managed to do it fast. So everyone keeps on speaking about time, and thank you so much, Victor. We actually went a little bit above the timing of our meeting, but anyway, I think that these topics were so important to mention. And yes, I would like to thank all the participants of the meeting today. Thanks to Victor for co-chairing this meeting. I want to thank all the speakers for joining and sharing all the valuable insights that were worked by you. And I would like right now to say that, taking into account the beginning of the summer season, holiday season, our next meeting in the discussion format will happen in September, because actually we know that a lot of colleagues and speakers that we engage, they will be on holidays, and Anyway, we will meet in 2 weeks in the briefing format. And besides, we stay in touch in between. Take care. Thank you so much. And contact the technical working group on MHPSS if you need so and have any questions. Thank you so much. All the best. Goodbye.
Дякую, дуже змістовно і натхненно, дуже
Thank you.
приємно.
It was very informative and very helpful, very fruitful. We invite everyone to Chernihiv. Thank you.